Hi, Jeremy.
Hi.
Good to see you again. I'm Dr. B. We're going to be doing a full body skin mapping on you today. And this is good to get once a year just to make sure there's no changes, nothing abnormal on the skin, nothing underneath the surface of the skin that we can see, and just an overall health check of the largest organ on our body, which is our skin layer.
That sounds great.
So, do you have any questions before we begin?
No, I don't think so.
Wonderful. So I'm just looking back at last year here. And I know we've done a couple of sessions with your face and your back. We've never done a full body though, looks like. So that'll be good to get one in the books. So today is Thursday. Any issues with your skin that are new to you? Any new changes?
Not really.
Okay. I know it's winter right now. Is there any excessive dryness or sweating or anything unusual?
I guess I have been having maybe some more dryness in my hands especially. Just I've found a few patches that are new.
Okay. Let's take a look at those. Okay. And any rashes, patches of red, bumpiness, anything like that that you noticed?
No.
Okay. What about acne? Just from looking at you, it looks pretty clear. Any acne elsewhere in the body, the back, the arms, nothing like that? Okay. Okay. And how about any fungi in the nails, any warts, anything like that?
No, nothing like that.
All right, wonderful. So it looks like it's going to be a pretty basic inspection today. I'm going to start out with just looking at you, put on some gloves. We're going to work section to section. So I'm going to start out with your face, we'll move down to your arms, and then we'll take a look at your legs and your chest and your back.
Okay.
So first, putting on gloves, just want to make sure there's nothing, no open wounds, sores, oozing, that kind of thing, and then we can take a closer look at the skin. There's nothing that I can see. Just looking through the scalp as well. Any issue with ingrown hairs or pain in the beard?
No.
Good. I am noticing that same multiple color in the beard like last time. It hasn't changed too much. Just picking a couple spots on the head here to take a look at. Just keep your eyes closed for me. I'm just going to look at the other side. Just going to look at the lips. You spread your mouth apart just a little for me. Just going to look right on the inside here. Just look for any freckles that might be hiding there right on the surface, and that looks fine. See a little bit of dryness on the ears. You said that was new in the winter, or is this more usual for you?
I think it's new.
Yeah. They're just a little bit red too, which I think could be from the cold. Do you often walk outside, or are you outside often?
Yeah, quite a bit.
Okay. Yeah, so I just maybe just wearing a hat, protect those sensitive ears here. But looks fine otherwise. Okay, Jeremy. So in general, I didn't see any major concerns. And I just want to take a closer look rather, with a magnifying glass. So again, just look straight ahead for me. I'm just looking at each of the sections of the face too. So we'll start with this top section here, the forehead. The tartar is good here. Don't see excessive oil. The pores are rather fine. Hair distribution is normal, just a light peach fuzz on the face. There's just one tiny little blemish there, but really clear otherwise. Do see a bit of a freckle there. I want to take a closer look at that. Okay, I'm just going to take a little bit of a closer look there and with my I'm just going to make a cool little note there to look with the infrared light. Okay. Just back checking out the other side. And this one looks very clear. Bit of scarring here. That's pretty old. It looks like at least 10 years. Is that right?
Mm-hmm.
Okay. It's just an aesthetic thing. There's nothing unhealthy about it. Moving on down, I do just see another little freckle right there, right past your right eye that I want to take a look at closer. And that one actually looks fine. Moving on down to your cheeks, you have a little bit more fat in the cheeks, which is typical. But the skin is nice and moisturized and supple. If you look at the nose, there is just a little bit more, a little bit larger pores on the nose, but again, that is typical. There doesn't look to be anything that's inflamed or infected. Just gonna look at the other cheek. That looks nice and healthy. Good distribution of the beard. Do you have any issues with beard growth, or does it grow pretty consistently?
Very consistently.
Okay, good. So this is a few days shaved.
Yeah.
Okay. So that's good. There's one little spot I want to look at here a little closer. And it is just right on a hair follicle there. Yeah, let's take a look at that one later too. Just gonna look with a little bit of a different light so we can make sure there's nothing else going on there. And then of course the beard does cover up the chin of your face, but everything looks really healthy there. So let's go ahead and look with that blue light before we move on to the neck. Jeremy, again, just look straight ahead of me. I'm just going to look with a slightly different light here, and close your eyes for safety. I'm not seeing any broken blood vessels under the skin. Okay. All right, let's move on to the neck. I'm just going to look at the skin, the hair distribution around the neck. Do you have a little bit of a mole there, freckle there? Just going to make a note of that. And let's measure it as well. You don't seem to have too many freckles. This one is about 1/8 of an inch, but symmetrical, round. Just make a note. Okay. Just taking a look at the chest as well. And that all looks fine. I'll just give it a quick look with the light. Okay, I'm going to have you remove your sweater. I'm going to take a look at your arms. Okay, I'll start out with this left arm. I'm just going to push this up. Is that okay?
Yep.
Let me just take a quick look first, make sure there's no open wounds. Nothing, okay. No cuts or scrapes recently, right?
No.
All right, just take a general look then. I do see a little bit more freckling on the arms. Just interesting, you don't have any really on your face, but you do seem to have them on the extremities. And there is a little bit of a larger one back here. That one is 1/2 centimeter by 1 centimeter, so a little bit of asymmetry. So just go ahead and mark that. And take a note. Lay down the arms, good hair distribution. You said that, oh, I see that little bit of dryness. Is that right on your knuckles there?
Yeah.
You see that redness? Let's take a look at that. And that does just look like dry skin, maybe a little bit of eczema. Is it itchy at all? Uncomfortable?
Not too bad.
Okay. It's pretty mild, but I can definitely give you a topical cream for that to take away some of the discomfort. Let's just take a quick closer look at it though. Can you just hold it up for me, please? Okay, yeah, that looks like dry skin. There's a little bit of build-up flaking there. So I'll look at the other side as well, but let me just finish with this arm. There's just this constellation here, just this section of freckles I want to look at because it's pretty isolated. There's really none here, none on the inner arm. Let's just test that. I do want to keep an eye on that. Make sure it's not going to become a cluster patch, that there's nothing wrong with the skin follicles here. Okay, take a look at the other side. You can put that down. Same thing here. This arm is generally a little bit clearer of freckles. There is one large one there. It's only about 1/4 centimeter in diameter. There is just a little bit of almost like a second one forming here. Is that something you've noticed before?
I have not noticed, no.
Okay, let's definitely watch that one. Moving down. A couple of really small ones here, but they're not raised at all. So I'm not too worried. And again, good hair distribution. Really no blemishes, very clear skin, very soft and warm to the touch. Dry. And I don't see that same dryness on the tops of your hands on this side. There's a little bit on the inside of the hand. And again, that same topical will be perfect for that. Just want to see if there's anything I missed. Okay, I think that looks fine. Just going to test some of the sensitivity of the skin to make sure that there's no lack of sensation or excessive sensation. Just a couple of little things. Starting out with there's a little puff of air. So I'm going to show you on your chest. Do you feel that on the skin?
Mm-hmm.
Okay, I'm going to puff it on your face. Just tell me if you can feel it. You can just say yes.
Yes. Yes. Yes. Yes. Yes.
Okay, did that sensation feel differently anywhere?
No.
Okay, perfect. Try the same thing on your arms. Just a little puff of air.
Yes. 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 Yes.
Flip them for me.
Yes. Yes. Yes.
Good thing. Same thing on this side.
Yes. 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 Yes.
Okay, that's wonderful. I'm gonna go with like a slightly lighter touch now. So same thing, just say yes if you feel it.
Yes. 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 Yes.
Okay,
Yes. Yes. Yes.
flip the arm for me.
Yes. Yes. Yes.
Okay, this side.
Yes. 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 Yes.
Okay, and does this feel like rough, sharp all the way down your arm?
Mm-hmm.
And it feels the same the whole way?
Yeah.
Okay, on this side. Same sharpness all the way down.
Yeah.
This feels as sharp as that.
Yes.
Here and here,
Yes.
here and here,
Yes.
and there.
Yes.
All right. So your sensation seems fully intact. We did mark a couple of spots here on your face and your arms that we want to watch, and I made those notes. But now I want to have you remove your top, lay down, and I'm going to look at your back, okay?
Sounds good.
All right, Jeremy, I'm just going to take a look at your upper back. Again, just put some gloves on to examine the full back before we get started. Any sensitivity when I'm touching you here?
No.
Okay. There looks like there's no spots of any broken skin or anything like that. So go ahead and take a look. I do see right away a couple more freckles in the back here. There is one that is raised, so I'm going to get a couple measurements here. Okay, it looks like we have about a 1/2 centimeter by 3/4 centimeter and raised by 1/4 centimeter. Definitely want to keep an eye on that one, especially because there's a little bit of discoloration, but it is relatively symmetrical. Just look really closely here. Yeah, we may want to consider removing that for next time. Just a couple small flat marks here. A little bit of unique shape there as well. Let's take a closer look. This one is completely flat, but it is asymmetrical, so let's just take a quick look. Okay. This way we have it on file for next time. Otherwise, the back looks in relatively good shape. I'm going to do that same sensation testing really quickly. Pull this down a little bit more. The lower back looks completely clear. So again, a little puff of air, just say yes when you feel it.
Yes. 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 Yes.
Okay. And a nice soft touch. Do you feel that?
Yeah.
Okay, and just say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay. And I want you to tell me if this feels the same sort of sharp roughness all the way down the back.
Yeah, it did.
Okay, and how about this side?
Yes.
Okay, and right down the middle here from the neck down.
The same.
The same. Well, Jeremy, the back actually looks like it's in really good shape. Just we'll circle that other one as well. We'll take some photos on your way out. But I don't notice anything concerning other than those couple of spots that I marked. So let's go ahead and move down to your legs. All right, Jeremy, let's take a look here at your legs. Do you mind if I take your socks off?
Yeah, fine.
Okay. This side. I'm just going to put some gloves on to take an initial look. Any issues with the skin on the legs and the feet that you've noticed?
That's what I've noticed.
Okay. Just take a look. Just look here. Okay, on this side. Alright, looks good. No obvious blemishes. One flat freckle there. One there as well. Just mark that. Checking on this side. Really clear on this side. A little bit of dryness on the heels here. We can get you a bit of a scrub to take home. But otherwise, your feet look good. Hair distribution is good. Just take a slightly closer look here. Okay. That all looks fine. Sometimes the skin on the lower extremities can be prone to coldness. It's a little cold in this room as well. Okay. Hi, Tori. I'm Dr. B. I'm going to be taking a look at your skin today. We're going to be doing a full skin mapping of the face and a little hair check here. Okay. Have you ever had skin mapping done before?
No.
So what it is me separating your face into sections and looking at each of them individually to see the skin type, the makeup, what issues you may be facing in each of those sections, and then we'll go ahead and apply some treatment if we have to.
Okay.
So upon initial inspection, the face looks pretty clear. You have a couple of nevi, a couple of freckles. Okay, no obvious bruising or cuts or scrapes, right? Nothing that would be painful if I put product on?
No.
All right. I'm just going to take a closer look with my magnifying glass. You can just close your eyes. Pores are pretty minimal on the cheeks, a little bit more noticeable on the nose. That's very normal for everyone. Eyelashes look nice and long and thick. Just gonna have you turn your head slightly for me. All the freckles are small and round, so not worried about those. Looking down towards your chin. You have a couple of blemishes. Is that normal for you to just have a couple of acne?
Yes.
Yeah. Yes, I feel you there.
Mm-hmm.
That definitely can happen with stress, with age, just as well being younger. Our bodies are still working with hormones.
Mm-hmm.
Okay. And the lips look nice and soft and supple. I'll take a closer look when I have my gloves on. Really no lines or drooping of the skin at all, which is great. You're obviously still very young, but it's something to consider as you get older to do some toner, some tightening.
Mm-hmm.
We can even do a little bit of lifting towards the end of this session. I'm going to divide the face just using a removable marker here into 6 sections. And this is just going to help me keep track of what I'm looking at. So I'm going to start with section 1. You do have a little bit of cloggedness in your pores, a little bit of sebum. Do you wash your face at night?
Mm-hmm.
Okay. Yeah, just on the top here, actually, by the hairline. Do you use any hair products?
No.
No. How often are you washing your hair?
A couple times a week.
Okay, good. So that first section looks pretty good. There's just that one blemish, but otherwise perfectly clear. The hair is nice and thick by the hairline, not receding in any way. Lift your head for me, please. I'm just going to pull some of this, you can lay it down. I'm just going to pull some of this hair out of the way. It's just a little bit in the way. Does that feel okay?
Mm-hmm.
Does this one hurt at all?
Mm-mm.
Okay, good. And the eyebrows look good. Do you pluck your eyebrows?
Mm-hmm.
Okay. They're good shape, symmetrical too. Just see if any oil comes off. Just a normal average amount, not excessive oils. Lean to the other side. Just tilt your head for me. This side is nice and clear. I don't see any blemishes. Looks a little bit drier than the other side as well. That was clear. Here's one nevi here. That's round, symmetrical, not raised at all. Move down to your cheek on this left side. The pores here are much smaller. There's less oiliness, a little more dryness. Completely clear. Down to that chin. A little bit more oiliness here, especially right on the chin.
Mm-hmm.
So we can do a little bit of a light treatment on that to try and minimize those pores and reduce some of that oil. All right, this way. We do have that one freckle here. It's just a little bit raised, so just keep an eye on that. Again, this cheek's a little prone to dryness, so we'll do some work there as well.
Mm-hmm.
Okay. I'm going to measure the sections of your face to see if we've got facial symmetry on each side. So just slightly bigger on the left side of your face than the right side of your face. That's the same all around. And the skin in the neck is nice and taut. I don't see any sort of wrinkles or blemishes. Good. I'm going to peel this back. I'm just going to look gently at the bit of your hair here that touches the skin. That looks great. I want to take a look at your face now. And with face mapping, what we do is we break the analysis down into sections. So we've got the chin section here, the cheeks section here, the nose, the forehead. And we do that because different parts of the face produce different levels of oil or dryness in some cases maybe. And so we want to treat them individually. We don't want to treat it as a whole. As you may know, the skin on the forehead is a little bit tougher, a little bit more taut across the face, versus the cheeks are much more plump, oftentimes prone to redness, rosacea, things like that, while the nose is often prone to blackheads. The pores are a little bigger on the nose than the rest of the face, so it just makes sense for us to look at it in sections. So let's start out with the forehead here. And what I'm looking for is just the makeup and the complexion of the skin. And so we've got fine pores up here on the forehead. Looks like no breakouts, maybe one little. Is this something you may have picked at there, or?
Oh yeah, I think so.
Yeah. Okay. See just a teeny bit of scarring, and that can just be from acne or just age and the skin changing. But your skin looks really clear and healthy. Beautiful skin, nice and moisturized. Just a couple little freckles here and there. I think you have freckles along the face though, so that's typical for you, right?
Yeah.
Okay. Just keep your eyes closed. I'm going to move down. Just look at the eyebrows, and the hair is thick and they look pretty symmetrical. Let me just double check that. If we see any unusual hair growth in this section, we just like to track that. Okay. Those are perfectly symmetrical. I'm just going to measure from the eyebrow to the ear. Okay. And just from the midline of the nose to the start of the brow. And those look great. Measure across your forehead here. You have a really nice symmetrical forehead for the size of your face. Proportional wise, it's really good. It is less than half the face, which is great. That's what we're looking for. The length of the brow, about 9 centimeters, and versus 17 for the half face. Again, on this side, same thing. Perfect. Just going to check the arc of the brow as well. well. Okay. And it looks like both have the same arc dimensions, and that's perfect as well. So let's take a look at those. I'm just going to look at everything first, and then we'll do the treatment together. So moving down now to the cheeks areas. And the pores are small, a little more freckling there. Do you wear sunscreen daily?
Not daily.
Okay. Might want to try incorporating a sunscreen into your routine in the morning, or having perhaps a tinted sunscreen as your makeup if you do wear makeup.
Yeah, I should.
Just want to protect that skin. So there definitely is some more freckles there, but nice and clear. Pores are small. A little bit of oil on the cheeks. That's very normal, very typical, especially because I'm shining a bright light on you. Any tenderness on this part of your face?
No.
Okay. Just going to take some of these measurements again. I'm looking for the symmetry. So I've got from the nair to the base of the ear here. And that's perfect. So no swelling that I've noted there. And I'm just going to keep your eyes closed. I'm going to gently get from the corner of the eye down to the base of the face. There's just a touch of asymmetry there. It looks like there's just a little bit longer on the right side than the left side. That's totally normal as well. But I think nothing to be concerned about. Take just a couple of measurements to confirm that. About a centimeter difference, or half a centimeter even, nothing noticeable. And that is perfectly symmetrical. Moving on to the nose. So I am seeing just a few blackheads in the nose area. See a little bit of oil there. And you do have a beauty mark, it looks like. Does that bother you at all?
No.
Okay. Just a typical amount for the nose, nothing unusual or abnormal. Just measure from nair to nair. Symmetrical. Just going to make sure that it comes up the same on both sides. Very good. And lastly, just looking at your chin. And the chin is beautifully clear and not too oily. Maybe a little bit of dryness right at the bottom, but honestly the chin looks really nice. Just feeling for plumpness here. Good moisture distribution. Good skin elasticity. Sorry. And good symmetry as well. The chin's looking like it's in great shape. So let's go ahead and address some of that oil production here in the top portion of the face. So we're going to be doing a skin assessment, face mapping, and some light therapy on you today, correct?
Yeah.
Awesome. So let's start by just taking a look at your skin. Just doing a visual inspection here. And do you have any issues with your skin? Any excessive dryness or oils production, anything like that?
Yeah, sometimes a little dryness.
A little dryness? Okay. Keep an eye out for that. Before I touch your face at all, I'm going to go ahead and do a light inspection. Close your eyes for me. And I'm just going to take a really deep look at every part of your face with this light. And I'm just checking for any freckles, nevi that look concerning, as well as any spots of dryness or excessive oil that would lead me to believe that there's something going on with the section there, the pores. With face mapping, we split the face up into different sections because your skin is different along your entire face. You have different zones that are going to result in slightly different types of skin. And I'm seeing that there is a little bit of oiliness on the nose and around the ridges of the nares, and that is normal. It's part of what's called the T-zone. As well as some dryness around the eyes. Do you have any tearing when you get tired or just due to allergies or anything like that?
Sometimes, yeah.
I find often with my patients that in the cool weather, that can definitely happen as you start going outside and your warm body is hitting the cool air. It can produce some tearing. Turn your head to the side here. Doing okay?
Yeah.
I am noticing just a little bit of scoring here. Looks like you might have had that injury quite a long time ago.
Yeah.
Okay, so we can do a little bit of light treatment on that too to try and reduce the scar look there. And just a couple of nevi here and there, one right at the top of the head that I'm noticing. Bottom of the chin looks good. Go ahead and look forward for me. I'm going to take a closer look now. Just going to use my magnifying glass. And I'm just examining those couple of spots that stuck out to me. Just take a look at this one nevi here. And again, there's going to be a bright light, so just keep your eyes closed. Okay. So that is looking pretty symmetrical, pretty small, even borders. See another little scar right up here. I want to focus a little bit of the light therapy on that. Turn your head gently for me. I'm not seeing too many ingrown hairs. Do you ever have any problem with that in your beard?
No, not really.
Okay, excellent. And just checking the scalp where the hair meets the face here. Turn the other way from your face. There we go. And same thing on the side, looks really healthy. Just looks a couple of spots that I noticed. There's one nevi there that looks a little bit irregular, but it's not raised or anything like that. Okay, all right, great. So go ahead and turn forward here. So I'm going to start the face mapping. I'm just going to put on some gloves for that. I don't want to touch your face with any of my oils on my hands. And what I'm going to do is break up this face into sections. There's going to be 2 sections along your forehead, your cheeks, your chin, and your nose. And to just separate that, I'm going to just draw some dividers here, okay? And then we're going to go ahead and test and treat each section. And I'm also going to be looking at your chin. However, because you do have a beard, I'm not going to draw on that section, alright? I'm quickly just examining the eyebrows and the eyelashes while I'm here, and the eyelids. First thing I'm going to do is just check for oil in each section. Just going to be blotting each section, and your face is unwashed, correct?
Mm-hmm.
Okay, perfect. And do you use any products on your face?
No, not really.
Okay. I'll just label that section 1. Sorry about that. Try that again. So I'm definitely seeing the most oil production on that nose and that T-zone in section 6. So I'm going to start with focusing a little bit on that. So I do see that the pores are quite large compared to the rest of your face, where it's pretty smooth and you're not really seeing the pores. My name is Dr. B. I'm going to be doing an assessment on your back, specifically looking at your skin. I'm going to be dividing it into sections and doing a little mapping, measuring out some of these spots and nevis that I'm seeing, taking close looks at them, as well as getting some samples of the skin, the upper layer here, that we can take a look at in the lab, okay?
Sounds good.
Have you ever had this done before?
No, I haven't.
Okay, well, none of it should be painful. Some of the sensations might be something you're not used to, so let me know if there's any discomfort there. But otherwise, I'll just explain what I'm doing as I go, okay?
Okay.
Perfect. I'm just going to be taking some notes along the way on my tablet here. So if you hear me typing, I'm just making some records of what we're seeing now. So when we check again in a year, we have those on standby, okay? So I'm just doing a general inspection here with my naked eye. I'm just going to feel the temperature of the skin all the way down. It's a little cooler towards the bottom. It's pretty normal. Got all of your organs and everything working on the top. And it's consistent on the other side. Just checking with the back of my hand as well. Good. And also just taking a quick look. I'm going to look closer with my magnifying glass and light. So first thing, just with the light. I'm going to do this in sections first generally, and then I'm going to break it down. So making a note that there is a little bit of scarring. There are a few moles and freckles here and there. Thin layer of hair is evenly distributed. Have you ever had issues with ingrown hairs or acne on the back?
A little bit of acne, but nothing crazy.
Okay. Yeah, as you see, I see one blemish there, but overall very clear, very healthy looking. there any pain when I'm touching on your back here?
No.
Feels
No.
okay?
No.
Just gonna do the other side. No pain?
No pain.
Okay. I do see one large nevi here I want to take a closer look at with my magnifying glass when we section off the skin. Alright. Do you have a favorite color?
Green.
Green. Okay. So as I mentioned, we are just going to segment off the skin here. I'm just going to divide your back into 6 quadrants. And we'll just use my green marker for fun. And the upper back is about 14 inches wide from end to end, so go ahead and find that midpoint. And we've got about 21 inches, and we'll divide that by 3, and that's going to be 7 inches per quadrant. So as I mentioned, Jeremy, I'm just going to look closely at each quadrant, one at a time, with my magnifying glass. I am seeing some freckles on the base of the skin, pretty evenly distributed, I'd say about 1 millimeter apart, pretty consistently. There's a scratch here. Did something happen, or were you just perhaps scratching an itchy spot?
I'm not sure.
Okay. I'm going to take a little sample of that towards the end of the exam. It does look a little red and raised and bumpy, so we could be having some allergy reaction there. We also have a raised nevi here, basically a big freckle mole that's protruding from the skin. I'm going to go ahead and make some measurements there. So I'm seeing that this is about 2 millimeters tall. And 3 millimeters wide. Looking at the symmetry here, there's a little bit of asymmetry there. I'm going to go ahead and take a little bit, just scrape a little bit of that into a vial so I can test that to make sure there's nothing nefarious or malignant going on there, okay? It's not going to hurt at all. Okay, I'm going to put on some gloves. There's another spot there, and that's pretty small. Measure that out. That is less than 1 millimeter by less than 1 millimeter, perfectly symmetrical, so that little guy's not something I'm worried about. I'll make a note to watch it for next year. Okay. So the only couple of spots here I'm worried about are right here. I'm just going to make a circle there. And I just want to remind myself to test that one later. That one looks okay. A couple of bigger freckles here on the shoulder, but do you wear sunscreen consistently?
I tried to.
Try to, okay. And you're pretty pale, which is consistent with genetic background, but also looks like you probably protect yourself from the sun, which is good. I would definitely recommend, since you are so pale especially, either sunscreen or covering anytime you're in direct sun. Good. I'm going to go ahead and take a mold of just the skin pattern on this part of your back, and I'll do this for every section. Perfect. All I'm looking for there is any unexpected indentations, any scoring, or any big sort of changes on your skin not consistent throughout. Great, I'm going to move on to the next section now. Do you see that one blemish? It looks pretty healed though. Consistent hair distribution. Again, I would say freckles every 1 millimeter. We're seeing some slight pigmentation at the entrance to a hair follicle, so not abnormal, but definitely makes me want to make sure we're being sun safe. I'm just going to measure that nevi right there. We've got about 1.5 millimeters, round, consistent. Mark that we've looked at that. Okay. And this one's small, 1 by 1, but because it's slightly red instead of the brown that we're seeing, I'm just going to watch that one as well. Okay. Very good. Go ahead and take a mold on this side. Okay. Just noting that that segment, quadrant 2, looks pretty healthy. Now that we've done the top 2 sections, I'm just going to check them for symmetry. Got pretty symmetrical from the crest of this arm to the top of your shoulder blade. And check on this side. Maybe a little bit shorter on this side, actually. Just checking that the spine is symmetrical on each side of the neck here. Good. Now this quadrant looks really clear. One little bit of redness there. Keep an eye on that, just make a quick note. For now, I do want to move on to your face. I'm just going to change my gloves here. I'll start out just by taking a look. And have you had any trouble with your skin lately?
Not really.
Okay. Just feeling the back of my hand for temperature. Warm and dry to touch. Very good. Basic symmetry is very good. Eyebrows and eyelashes look even. And I see that there are some freckles on the face. Is that normal for you?
Yes.
Any new patches that you've noticed lately?
A little bit.
Where about on your face is that?
I've just noticed some on my nose a little more than usual.
Okay. Take a look there. Yep, and I do see that, but those look completely flat. Definitely important to be wearing that sunscreen, but I'm not worried about. There's no moles, it's just freckly. Okay, just checking the skin down here. Everything is nice and clear. Are you washing and moisturizing your face daily?
Yes.
Good. All right, so let's take a look section by section. The reason we do face mapping and separate each section is so that we can really look at things individually. The cheek structure and skin structure of the cheeks are very different from the forehead. It has a little bit more fat behind the cheeks, as well as the oil buildup can be different in the forehead and the nose. So we want to treat everything differently. Okay. Do you mind if I just draw the sections on your face so I can look individually?
That's fine.
Okay. So again, I'm just going to make a few sections here. I'm going to start out with this top right section here. Skin looks good, pores are small, oil buildup is normal. Good growth in the eyebrows. Have you noticed any loss of hair in the eyebrows or eyelashes lately?
No.
Good. And there's very few freckles in this section as well. So that's very good. Okay, any tenderness when I touch this?
No.
Test this section for sensation. Can you feel that?
Yes.
Okay. And can you tell the difference between this rougher and this soft?
Yes.
So I'm going to touch you and I want you to say sharp or dull depending on what you feel, okay?
Okay. Sharp. Dull. Sharp. Dull. Dull.
Very good. You're taking a look at the other side. You see a little bit of a blemish right here. Any pain on that?
No.
Looks like maybe a little bit of a scarring or just a little bit of a spot there. But otherwise, again, looks clear. Very few freckles in this section. Same thing, just say yes when you feel it.
Yes. Yes. Yes.
Okay, and tell me sharp or dull.
Sharp. Sharp. Dull. Sharp.
Okay, perfect. Just looking a little closer at the eyebrows. Those are even. Hair is thick and strong. And you said no loss, so that's good. Okay, moving down to the sides of the face now. Let's start on this side. And I do see a bit of freckling starting right here. There's a little bit more oil production, as is normal for this part of the face. I'm going to lightly tap above your eyes. Just feeling for the texture there, and that's nice and smooth. Okay, this side. Same thing, a little more freckling here. Skin is nice and taut. There's really no wrinkling at all under the eye, which is great. Tell me yes when you feel it.
Yes. Yes.
Okay, and same thing, sharp or dull.
Sharp. Dull. Sharp. Dull.
Good.
Dull. Sharp.
Very good. Okay, now I'm going to move down to the nose. This is where we usually see a little bit more buildup and pores a little bit bigger. Yours are pretty small. Are you exfoliating at all?
Twice a week.
Okay, so that's probably why your skin is in such good shape. Really not, just a little bit of oil buildup right in the nares there, but again, that's as expected for our face and our oil production. Your skin's really nice and clear. You feel that?
Yes.
And that?
Yes.
And what does that feel like?
Sharp.
What's that feel like?
Dull.
Great. Take a look at your cheeks. And this is where you have the most freckling right here. I'm just going to measure one right over here. Just a little bit bigger than the rest of them. But still only about 1/8 of a centimeter. And that's the same, symmetrical. Good. Just feeling for the plumpness of the cheeks, good collagen production. Again, no wrinkling, no excessive dryness. Feel that?
Yes.
Does it feel the same as on this side?
Yes.
Okay, what's that feel like?
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Very good. And moving down to our last section, just looking gently at the lips as well. Looks nice and moisturized. And the chin. Again, very small pores. You can definitely tell that you exfoliate and take really good care of your skin. Looks really good. And last thing here, does that feel like that? Feel that both sides?
Yes.
Okay. And is that as sharp as that?
Yes.
Okay. So the skin is looking really good, really healthy, as is the hair, just other than that one little spot. Just want to measure the face, just measure for symmetry. I'm going to follow my section lines here. I'm just going to get from side to side. that symmetrical. Maybe a quarter of a centimeter at most asymmetry there, but again, none of us are perfectly symmetrical. Okay, that looks good. I'm going to get a circumference. It's going to involve me coming around here. Okay. Oops, I apologize. Good. I'm just going to make a note of that so we can track any swelling. Eyebrows are good. Eye to eye. Very good. Again, I'm just going to use that same tool just to see if there's anything visually I can see. So just keep your eyes closed. Checking the tapering of the face here. And what we should see is that the center of the face is the widest part, and it creates the oval shape with the chin tapering in and the head tapering in just a little. And we do see that here, so that's wonderful. All right, well, Kate, I think your skin's looking like it's in really good shape. We did just address that scalp problem there, so I want you to go ahead and monitor that. And if anything gets worse or more uncomfortable, I want you to come back and see me, okay?
Okay.
Do you have any other questions for me?
No, that's it. Thank you.
Okay. Hi, Jeremy.
Hi,
How are you today?
I'm doing well, thank you.
Good. Glad to hear it. So I have you booked in today for a face mapping skin exam and then a rejuvenating facial. Is that correct?
That is.
Wonderful. So the first thing I'm going to do is take a look at your skin. It's a technique called face mapping, and I'm going to explore the different sections of your face and just see what type of skin you have along your face before we decide on what the best treatment is, okay?
Okay.
Wonderful. So I'm just going to put on some gloves so I can take a closer look at your skin. Alright, I'm just going to start out with a basic visual inspection. You can go ahead and close your eyes for me. It looks pretty good. There's a little bit of discoloration. I don't see any oiliness or dryness. A couple of spots that look like could be some small scarring or just large pores right above the eyebrows. Your pores look small and even distributed along the hairline, which is good. And not too many lines or issues with wrinkles, anything like that. You're still young, so that might be something you deal with later. Moving on, just looking at the eyes. I'm going to gently touch your eyelids. Looks like there's a little bit of darkness under the eyes, so we do want to do a rejuvenation for that. Looking at the sides of your face, I see just a few spots here, freckles, nothing to be concerned about. We can do some work on those. And then on this side of the face is actually pretty clear. Just one light scar that we can try and take down a little further. Moving on to the cheeks. Skin looks healthy and good and clear, even coloring, and just a few larger pores on the lower cheek, and the nose as well. The nose does have quite a few pores here. We might want to do a few extractions there. I you see some blackheads into the skin, or there's a little bit more oiliness there than the rest of your face, which is pretty even. And then moving down here into the chin, you do have a beard. So, but it looks really healthy. There's no patchiness, there's no dryness. I'm not seeing any ingrown hairs at first. Let me take a closer look at everything with the light, okay? Please keep your eyes closed for me. I don't want you to look directly into the light. Good. I'm just confirming that the forehead looks pretty good. There are quite a few freckles there. And make sure you're wearing sunscreen. We'll make sure to put a little bit on before you leave today. And confirming the beard looks great. Really healthy roots, no ingrown hairs. I think we can pretty much leave that alone, which is good. Okay, and looking at the eyebrow area, the eyes area, see a little bit of dryness, a little bit of those dark circles. Eyelashes look nice and healthy and evenly distributed. And there's just a little bit of extra hairs that have sort of made their way up past the normal eyebrow line, so we can go ahead and trim those for you if you'd like. And look at those nose. And yes, just a few blackheads right on the tip of the nose. That's extremely normal. That's where most people get them. So no major surprises then. And we can go ahead and start the facial. Okay, Jeremy, now that I have you laying down, I'm going to look with my light here. First, just take a quick look at the surface. I don't see any bruising or unusual redness. Nothing that looks like you had an impact to the skin. Take a little closer look here. Magnifying glass and light, especially in that affected area. Maybe a little bit of dryness, but no cracking or nothing severe enough where I would think it would affect the sensation of the skin or cause that tingling. Just going to compare it to the other side. Now checking down the spine for any injuries that may have occurred there. Looks okay. Check the temperature variations here. So got just a little bit of a cold metal tool here. Just want you to relax. Looks too swollen there. Let me just change that setting. There's just a little bit of heat in that area. Unsure if that's because there's some swelling or if because there's some discomfort. So you've been stretching it a little bit more or playing with it a little bit more. Everything else looks pretty clear. Okay, let's just focus on that top then. Also, are just a couple of spots around here. Sometimes, depending on how deep into the skin our nevi here go, they can cause some tingling if they go deep enough to the dermis and give us a bit of sensation issues. But none of these look particularly like they'll have large roots. And these are all quite small, flat. When I press these specific points, are you experiencing any additional tenderness?
No.
Okay. So yeah, I'm not too worried about those being a problem then. Just removing the majority of this marker off the skin so it doesn't get on your clothes. Whatever's left will just come off in the shower. I'm going to do the same thing. I'm just going to, where I test the spinal reaction to pressure, but I'm just going to use a slightly harder tool. Do you feel that? Is that too much
No.
in the unaffected area? Okay. I want to get a sense of how reactive that nerve, if that's indeed the problem is, okay? So I'm going to start hitting you, and I want you to just start calling out a number out of 10 for discomfort when I get to that point, okay?
Probably like a 5, 6,
5, 6.
6, 5, 4.
Okay, and that's where it goes away.
Yeah.
Just making sure. Okay. So a little bit more intense with more intense pressure. I'm going to run this object down your back, and I want you to tell me if it feels cold the whole way. Does that feel cold the whole way down?
Yeah.
Okay. There's no sensation loss. Does this feel any different than this?
Maybe slightly.
Slightly? Okay. What about this and this?
It feels the same.
Okay. This side, this, and this.
It feels the same.
Okay, so really centered on that spine here. I want to do some more testing there because that should feel the same as that. But you're saying, does this feel warmer here than it does here?
Yeah, slightly.
Okay. Starting out with just a puff of air, and I want you to tell me if you feel it when I puff. And again, you're going to hear a little bit of a sound, but I really want you to concentrate on what you're feeling and not what you're hearing, okay? I won't always be puffing at your back. Good.
Yeah, I felt that.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Very good. Okay, so the basic sensation is intact. So you're feeling everything. I'm going to touch you on one side of your back or the other, and I just want you to tell me left or right, okay?
Right. Left. Left. Left.
Good.
Right. Center.
Hmm.
Right. Right. Left. Right. Left.
Again, so you're able to tell side to side that you're being touched, so that's really good. Going to do a bit of a sharp scratching here. You feel the difference between that and this? Okay. I want to test to see if you can feel the difference between sharp or dull, and then I'll see if the difference is changed at all in the affected area, okay? So just say sharp or dull.
Dull.
Okay.
Sharp. 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 Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay. So you can sense the difference between sharp and dull. Now I want to see if there's any difference when I touch you with this dull here or down here. Does it feel the same here as here?
Yeah.
Okay, good. How about here and here?
Yeah.
Here and here.
Yeah.
Okay. And same thing with a bit of sharp. Does that feel as sharp as down here?
Not quite.
Okay, and here and here
Yeah.
and here and here.
Mm-hmm.
All right, so you definitely are having some nerve problems and sensation problems here. Nothing so serious that you cannot feel it, but enough where there is some difference, especially with the cold and the sharp. So that could indicate it's something a little bit when you press down on the skin or when you irritate that nerve, pressing harder than just this light touch is when you're starting to have problems, which again would mean maybe when you put pressure on that nerve that you have some tingling. Just want to measure that affected area. So again, just tell me when it starts to bother you.
Yeah, right there.
Okay, right here, and tell me when it stops bothering you.
Right there.
So that is about 6 centimeters of discomfort. Same thing, I want you to tell me when it starts bothering you when I come across.
Right there.
Right here. And when does it stop bothering you?
Right there.
Okay. And that's about 4.5, 5 centimeters. So probably just 1 or 2 vertebrae here that are the culprits. All right, I've got a bit of a tool I'm going to squeeze, and what I'm looking for is the swelling or the amount of skin I'm able to grab in that area. I can definitely see that as I move down the back, there's almost no swelling. But up here at the top, I've got about 40 millimeters, and it starts to go away right there. Same thing, no swelling here. Not much in that left shoulder blade. A little more on the right, but it dissipates. Definitely the most swelling right at that affected site. And I can feel it with my hands as well. I'm going to actually make a couple more marks. I want to test for symmetry now that we have some swelling, so I'm going to just mark your spine here. And it's pretty straight. There's maybe a slight curve right here at the top of the neck. But let's go ahead and check with the calipers here. Yeah, a little bit of asymmetry in those first two vertebrae, but not enough to consider it to be severe scoliosis. Have you ever had a diagnosis of scoliosis in the past?
No.
Okay. It's not something we've ever registered here. So that seems okay. Okay, nothing else seems too out of the ordinary. Jeremy, I'm under the consideration here that you have some swelling, possibly from the rower. If you are new to the rower and it's something your body's not used to, you may have tweaked something. That swelling that you can kind of feel when I press on it, right, is causing a little pressure on the spine. The spine's made up of nerves, and that nerve that has pressure on it is in turn causing some tingling and discomfort in that right shoulder. So I'm going to give you just a little bit of massage to try and break down some of that fascia there and get you feeling better, okay?